It's one of the favorite things I get to do every month to share some of the things that we've learned with the medical community. So, I'm really looking forward to this. For those I haven't had a chance to meet yet, my name is Scott Thompson. I'm a co CEO of Acceleration Point, and we've been in medical affairs for over 15 years, helping medical affairs really drive impact and using digital technologies often to do that. So, really excited. Today, we're going to dig into a topic that we've been asked about a lot because we do a lot of social listening, right? We've got a platform called Quello that does this very automated and gives it to all the MSLs. We have social listening that we do for congresses, and we do it for patient journey identification. We use the data quite a bit, but there's a lot of teams that we've talked to where they're not quite ready for something so robust. They don't need all the bells and whistles of the AI and the strategy that's built behind it. They just want to get started and they're stuck taking that first step. I was like, well, then let's do a webinar to show you how to get started using tools that you already have so that you can get started without major investments. Today is going to be a session where you're going to practice, you're going to learn some things. And so I need to make sure that we are able to communicate. If you could please, in the chat, put in where you are dialing in from. Just let's test the technology. This is an easy one. In the chat, just A, B, C, D, E, or F. What is your role in the organization? Put it in the chat and we can make sure we speak directly to you. All right, field medical, field medical, field. Oh, we got a social listening specialist and executive with us. Wonderful. Keep them in here. I love to be able to just know who we have because we can adjust our conversation for you a little bit. All right. Well, then let me introduce. I am super, super excited to have a guest with me today. Our guest is Shruthi Menon. She is the manager of our social analytics platform right here at Acceleration Point. Shruthi has been leading our team that's been creating all of the strategies around what we go listen for, how we do it, leads a great team. So, Shruthi, welcome. And you want to just give a quick introduction so that people know a bit about your background?
Sure, Scott. Thank you so much for having me today. And hi, everyone. I am Shruthi Menon, and I have been working with medical affairs teams to help them understand what's going on in social media so they can inform their medical strategies. I have over 10 years of experience in social listening, and I've worked on various kinds of projects. These include discussions from HCPs about new treatment options, patient journeys, unmet needs, as well as analysis of sentiment and perception around pharmaceutical products and competitors. I've done a lot of social listening. And I'm really excited to have all of you on the call today because I would love to share something. It's a simple methodology that we've created, and we want to show you how you can create a social listening or Congress listening report based on whatever tools you already have access to. So I'm really looking forward to today's session.
Wonderful. I am so excited. She is truly an expert. And when she joined us, she really just elevated our entire team's capabilities. So I'm so glad to share her and her expertise with you. Let me just maybe walk you through what to expect out of today. So we're going to really take this in three steps. I think it's important that we start with why social listening is particularly useful for congresses, right? That was kind of the premise of this session. So we're going to start with the why because the why will often drive the how. Okay, so we're going to dig into the why. The second is that there's often some challenges that I hear teams and companies having around doing insight generation through social listening, especially at conferences. So we're going to share what some of those common challenges are and then walk through in our example how we actually overcome those. And then the biggest part of today, because we want you to walk away capable of doing this yourself without spending any money, without hiring people to do it, is we're going to actually walk you through a real life example, logging into the different systems, pulling that data together, and putting it into a final report. Really excited for this session. And I think, Shruti, it might be really helpful. Maybe I can switch back to a poll here. One of the things that I think would be really helpful is to just understand how much experience you already have, your team. So again, just in the chat, put one, two, three, or four. One, we do not do any social listening right now. Two, you're doing it on occasion. You might have a company come in and do it, an agency on occasion. Three, is it like part of your ongoing social listening Congress strategy? Or finally, do you have it kind of fully integrated into your insights program where insight generation is ongoing in the social space, integrated with your other insights? So let's just see where that is today. Okay, so about half of you are on occasion. Some of you are doing this already regularly, and about a third are doing it deeply. Great. Wonderful. What we're going to do is for those of you that are a four, and this is already integrated in your insights program, this may feel very basic, but we want every single person in the team here in the organization to be able to do this work. And stay tuned. Don't leave us because we will come back at the end and cover a couple of things that I think will be particularly interesting to you if you already do this regularly. Okay. All right. So to get started, let's start with why we are doing social listening to begin with. And I think that it's really helpful. I'm going to give this over to Shruthi. I think that as we've started working with clients and they've been coming to you, you've had a chance to meet with so many of them, have conversations. Tell us a little bit about why at congresses. What are you hearing as like the big reasons that clients are asking you to do this?
A Congress essentially now, if typically in the current landscape, when an event happens offline, it also happens online. And that's one of the key things that's evolved over the past couple of years, that we have a lot of online activity. And anyone who's ever attended a Congress in person knows that there is just so much happening and all of it is simultaneous. So you have sessions, panels, discussions, posters, and so many presentations that you physically can't attend all. So you may have to make trade offs sometimes. So you attend one session and you have to skip another. So Congress social listening is a great way to get an overview of all of the sessions that happen at the Congress. And of course, people who attend the Congress share their opinion. So it doesn't just limit itself to information on the sessions, but people also share their opinions. For example, if an HCP attends a session which shares results about a particular product, they may share their excitement or disappointment depending on what the results of the actual study were. And a lot of these opinions are shared in real time because they want to share information that is specific to the event with their follower networks as soon as possible. So we've seen these updates come in while the session is happening or immediately after the session. And the best part about this is it's completely unbiased. We are not seeking out information here. We are not asking any survey questions to bias their answers. Everybody's sharing it of their own volition. And the level of engagement that they have is based on their interest in the session itself. So it's completely unbiased and organic. And apart from this, you are also able to identify new players, new HCPs who are outside of your network, who are also interested in the disease space. So you may not find them in person, but you can find them through social reports where they share or they engage with posts that are related to you or your disease space. And apart from this, it's a great place to identify competitor activity and engagement and see how that works so that you can use that to inform your strategy as well. And although I've shared a lot of points, I noticed that some of the participants are actually social media experts and are already doing a lot of detailed Congress analysis. So I would love to hear from you guys. What is it that you use it for? Like, why do you think Congress social listening is important? And what are the reasons why you feel we should do Congress social listening?
Yeah, so if everybody could just put just one or two words, it might be one of the things that we have on here. It might be a completely other reason, but why are you actually here in this session? What is it about social listening that you're hoping to get out of this? Okay. Extended reach, insights, new people to identify and target to engage with. The idea that the insights are real time, love that. Learn the way to do this, right? If it's been something that you've already been thinking about, now it might just be about how sentiment. Yes. One of the things that's really nice and social is that you can kind of hear a tone in that voice of what they're saying. profiling. Again, somebody else saying they're identifying some new people to engage with. Excellent. So they seem to be pretty similar to the reasons that Shruti shared. As we go into this, oh, topics that we can highlight. Excellent. So as we do the real life example, we will focus, even though there's other things we could focus on, but we'll make sure we focus on identifying people, ensuring that we're getting real time insights, and then a little bit about extending reach. And if we don't get to extended reach in the demo, Shruti, I can cover that at the end. Okay. Excellent. Let's jump to the next piece then, which is if you guys all came here to do this, you've all been thinking about it, you signed up. There's some common challenges that we hear every time that we start working with a team around this. The first is that they might go out on occasion, ask their MSLs, or somebody might go out and look at Twitter or X and look at LinkedIn and go look at YouTube and start to compile things. But there's so much noise that it's really hard to get to relevant content. In fact, if we do a search on any of these platforms about trying to just search the Congress itself, often what we end up with is a whole bunch of people trying to coordinate where to go for dinner or just sharing the fact that they are going to be there. And so it's important that we're able to filter down the data to things that are relevant about the diseases and treatments and scientific topics that you care about. Okay. And while there are more sophisticated ways in some of the tools that we use, we're going to show you today how to cut through the noise to get to relevant content. The second is that there's often so many people talking that we don't really know if the people that are talking about these topics are relevant. So, one of the steps we have to walk through today is to not just summarize the all the conversation, but also really narrow down to who is saying it. Partly for the reason you said, which is getting to some identification and targeting opportunities, but also in order to know that the people's voices that you might base your insights on are relevant, okay, and unbiased, and that they're people we should be basing medical strategy on. Another common challenge that we hear are some compliance concerns, especially when we're looking at information on HCPs where the standard in different countries is different. So, one of the things that we're going to talk about briefly here at the end is the idea that with social media, the person posting it remains in control of whether or not you see it. They can delete it anytime, they can make posts private. Most companies that have started to enable this and allow it really are starting to understand and adopt that part of the process. And then the last challenge that we'll often hear is that we just don't have access to the right tools. And so that's where we're going to spend most of our time today is yeah, there are tools like Quello that will do a lot of this in an automated way to make it fast and easy and apply AI and all that stuff. And again, those are great. But today we're going to show you how to use the tools you already have. We're going to log in to the different social networks, do searches, pull it together into a report live here in the sessions. Those are the big challenges that we're going to talk about overcoming. Anybody online, am I missing any? If I'm missing any challenges that you face, or maybe it's one of these that's your biggest challenge, put it in the chat for me again, just so that we can make sure that we prioritize time on the right challenges. What are the biggest challenges you are facing? Come on, if it was easy, nobody would be here on the webinar. All right, the time it takes to do the analysis, resources to do it, finding the relevant content. Yep. Organization, time and resources, generating the insights. Okay. Anybody else? So before we walk through the example, let me just talk to a couple of these real quick, and then I'll turn it over to do the demo and the walkthrough. Going too broad, yeah. I mean, there's so much content out there. What we're going to walk you through is the steps that allow us to start with a more consolidated set of information, right? If we start with a data set that's too broad, when we do the analysis on that data set, it becomes too hard. It's also often why it takes so much time for people to do the analysis. By us walking you through how to use the search strategies today in the different tools, you're going to get a more consolidated set of information that allows you to do the work faster. And then because that content is more targeted to your specific strategies, you're going to be able to do the analysis in a way that gets you faster insights. Okay, learning how ECPs bring Congress insights back. Oh, that's a good one. Yeah. And Shruti, one of the things to make sure you hit is a lot of people think about doing analysis during the conference, but what about the weeks leading up to it and especially the weeks after it? So I'll make sure that we cover that. Perfect. All right. Well, why don't I turn this over to Shruti? I'm really excited here. We're going to go through 3 steps for you. It's 3 pretty specific steps. We're going to talk about how to identify the platforms that we want to monitor. Second, we're going to go through the the specific strategies because the platforms are different. We're going to show you how to do a search on each one in a different way and what some of those strengths and weaknesses are. And then finally, at the end, we're going to show you how to create a report that helps you organize that content and all the sources. With that, I'm going to turn this over to Shruti and we're going to actually just share our screen live and go ahead and jump right in.
Absolutely. Thank you, Scott. Please give me a minute to share my screen before I get into the actual Congress. So the question that Scott started with here is 3 main steps that we would look at when we want to create a social listening Congress report. First step is to identify the platforms where the activity is going to happen for the Congress. And according to me, the best place to start is the official website of the Congress itself. So for today's example, I have selected the Endocrine Society's annual meeting, which is called Indo 2024. So usually what we observe is organizations that conduct these events usually set up a separate website or at least a unique domain specific to the Congress itself. And most of the information that you require about the Congress is present within this itself. So you will have all of the important dates for registration, for abstract submission, and other logistic information related to travel and location. And if you look at this website particularly, you have a lot of this information right here. So since this Congress is already over, it's most of it is about how it was wrapped up. You also have information here about the actual program, which gives you details on the different sessions, what time is each session happening, who are the presenters at each of these sessions, as well as where the physical location of which room these sessions are happening. So you have all of that information. You have information on the different abstract presentation, presenter instructions, all of the sponsor information is all present here. And what a lot of organizations also do is share an official hashtag for the event in the run up to the event. This is quite common now. So most congresses are already so established on social media platforms that they always, almost always have an official hashtag. Usually, this is an abbreviation of the name of the conducting organization or the name of the Congress, which is abbreviated along with the year it's conducted. For example, if we were to look at the American Society of Clinical Oncology's annual meeting, which everybody knows as ASCO, or ESMO for that matter. All of these are just abbreviated forms used along with the year in which it is being conducted. Some organizations also use the word Congress or conference after the abbreviation of their names. So that's how usually we try doing research on the initial stage, which is the official hashtag of the Congress. Now, there is some very important information that is usually present on the Congress website itself, which is right here, which is the list of accounts that the organization has official social media presence on. If you look at it right here, usually this is either at the top of the page or at the very bottom of the page for most organizations, if I were to guess. But how you can find this out is if you hover about this symbol, you can see it at the bottom left corner of my screen. It shows twitter.com/Indo Society. So this links to the official account of Indo Society's X account. This one links to its official Facebook page. This one links to its Instagram account. This one links to its LinkedIn page. And this one is for its YouTube channel. Usually, almost all of the information that you require in order to select what platforms you're going to monitor for are present on the conference website itself. So that's a great place to start from. And once you have selected the platforms that you would like to monitor, you can go ahead and build strategies for all of that. Now, since not all of you have access to a tool like Quello, which literally covers data everywhere, we are going to go into individual platforms to show you how you can gather data or how you can refine the data that is already available on each of these platforms so that you can create a final report. We'll also share what elements are involved in the final report. Before we go into the next section, which is strategies for individual congresses, I would like to open up a question to the audience, which is what are the usual platforms that you monitor while doing Congress listening? When you attend a Congress, do you browse through any particular websites to get an overview of what happened at the event? I'd love to hear from the audience about that.
Yeah. And if we can stop sharing your screen for a sec, go ahead and you can type the word, or you can go ahead and just type the numbers 1, 2, 3, 4. As Shruthi was saying, these societies have already identified the social platforms that their members use. That's why they are choosing particular platforms on the top to have official presence in. So that's why it's such a great place to start. Beyond that, different platforms have different strengths, right? Instagram is very visual, lots of photo, a lot of video. So dermatology often shows up in there as an example. LinkedIn has more longer form content, right? Twitter is kind of the grand central station, right? It's all the really short content where they'll often talk about other things that they've done on other networks, right? YouTube is all video. So I see a lot of folks saying Twitter for sure, LinkedIn. Yeah, I think those are probably the ones we hear most often. YouTube is becoming, it's actually this year, it became the second largest search engine in the world, right? More searches are done. So it's Google, then this, then everything else. It's becoming more and more present. Facebook is often associated with more of social, not professional. So that makes sense. Wonderful. And we have a question actually. Shruthi, maybe you know the answer. I can also share. Cassandra was asking, does our content analysis confirm that all these platforms are used by physicians? Do you want to take that first?
Sure. Yep. Based on our methodology, we are able to see the authors who are sharing a particular post. So of course, there is a judgment call that you need to make. Some people already have that information explicitly stated in their profile that they are specialists within a particular field. Some would have doctor or physician in their username or in the description of their profiles. So that's how we would determine whether they are HCPs or not.
Yeah. And then I think the other part of the answer is that across I think we're up to 29,000 HCPs that we're monitoring right now around the world. We are seeing relevant scientific content across all of these channels. We are seeing that Twitter and the news are by far the largest. But yes, they are being used across all of these different specialties, different diseases spend more time in different ones. Okay. If I could choose one or two, what would that be? Again, I'd see the if I was going to monitor one first, typically I would start with Twitter because I call it the Grand Central Station. Often we'll see that somebody will go to Twitter and say they did something in LinkedIn, or they'll go to Twitter and say, hey, did you see my new YouTube videos? If I had to prioritize one, I'd probably start there. Shruthi, I don't know if you would have a different recommendation.
I completely agree with you, Scott. I would also start with the X or Twitter as the first platform to go to because although there is a lot of information, a lot of HCPs specifically have built networks on Twitter. They've built up their organic following, and there's something called Med Twitter, which is kind of a big community within Twitter. So they tend to share anything academic or scientific within this community. And there is a lot of interaction within HCPs, not just within the same therapy area space, but also cross-functionally. So it's a really great place to monitor the conversation. LinkedIn is important. I do agree that there are a lot of official information that is provided on LinkedIn. A lot of companies post their updates on LinkedIn. A lot of company representatives who attended events post their updates on LinkedIn. But it's kind of a double-edged sword because it's a secure platform, so you don't always have all of the information that you would want to see. And you always need to tread a little carefully with LinkedIn because it's a closed and secure platform. So that's definitely one of the messages that I would like to provide.
So, Shruti, how about this? So we only have an hour total on this platform, so we may not get through every single one of these, but let's use the three that they said are the most important for them: Twitter or X, LinkedIn, and then YouTube. And let's start our demo. Let's actually do a conference listening project, starting at Twitter, then LinkedIn, then YouTube. If we have time, we can pick one more, but then we'll bring it all together and put it into the report.
Yes, absolutely. I'm really excited to show you the next part. This is the official page for the Endocrine Society's Twitter account. This provides a lot of information on the organization itself. But although their official account is present here, it's not usually the official account that shares most of the data. And of course, you can start your search from here where you look through all of the posts and see where posts related to the conference happened. But there is a better way to do this on Twitter. And before I get into that methodology, I would like to share three salient features of the data representation that should be present in your report. I just like to simplify it into three main points. And this is the same across all platforms. You would look for these three factors. The first one is how much, the second one is what, and the third one is who. How much is the volume of your data? As Scott said, there's just so much happening at the conference. You meet people, you want to interact with your peers, you're so happy to see them. You post a picture, you put it on X saying that, hey, I met this guy today at the conference after 5 years. It was so great catching up. Majority of your posts are going to be that. So in order to narrow that down into relevant information, which could be scientific, non-scientific, or even within scientific, information that is specific to your therapy area of interest. So that's very important. That's the how much. The next point is the what. What is being shared? What topics really resonate with the audience at the Congress? Are they talking about a particular study? Are they talking about a particular brand, a particular product? What is it that they're talking about that really received a lot of engagement at the Congress? That's the what. The third one is the who. Who is talking about it? Who are the accounts that are sharing the information about the Congress? Who are sharing their opinions? And who is it that is being reshared? That's also just as important. These could be accounts of HCPs, as one of you asked that, how do we know that they are HCPs? So we would be doing that analysis here as well. Are they organizations or are they advocacy groups? So there are so many people who attend the Congress and who are vocal about it on social media. So being able to do these focused searches helps us identify what that is. So across platforms, whether it be X, be LinkedIn, these are the three parameters you basically need to cover while you represent them in your report. So starting off with Twitter, Twitter has a very neat search function. You can just search for Indo 2024. I'm going to search for Indo 2024 right here. But I'm not going to stop just right here. I'm going to use their advanced search option. Now, how the advanced search works is there are different sections that you can use to refine your data. And I'm going to walk you through most of these because since we're only going to cover a few platforms, I can take some time to focus on Twitter. So here you have the first column, which is all of these words. So basically, this includes a simple AND function. So suppose if you want to search for all conversations related to diabetes that happened at end of 2024, you would use it in this format. Oops, sorry, I typed in the wrong congress, but that's also a relevant congress for me. End of 2024. And maybe I would do Cushing's disease. So I want to see what conversations happened about Cushing's disease at end of 2024. And this is how I would do it. The next section is this exact phrase. So here, if I wanted to look for two separate things together. So if I wanted to look for end of 2024 Congress, this is where I would type it. So it would occur as a phrase and not as two distinct words. So anywhere where the term Indo 2024 Congress comes, that's where the data would be pulled up. Any of these words. So this is a simple OR function. So it's either A or B. So if A is Indo 2024, and I also want to find out conversations on the term Indo 24, I would use both of these terms here. None of these words. This is quite simple. This is just a not function to exclude any mentions. So now if I want to exclude any mentions of diabetes here, I would use the word diabetes to exclude any posts that mention the keyword diabetes here. And these hashtags. So any specific hashtags. So here, since we've already identified Indo 2024, that's what I would be using here. You can filter by language. You can filter also from accounts. So how you use this function is if you are able to identify any specific HCP accounts or organization accounts from which you want to monitor conversations around a Congress, this is where you would type it. And to these accounts. So if there are any specific replies that you want to monitor, this is where you would type those account names and mentioning these accounts. So if any accounts have been mentioned within the content of the tweet, this is where you would type those names. These functions are all very useful, but I really like to look at the last section here, which is the engagement function. So this is what really helps you narrow down to content that is really engaging people at the conference. So here you are able to set up minimum threshold of replies, likes, or reposts. So replies are when somebody posts or tags someone in a tweet and they respond to it. So that's a reply. So that means they are engaging with the tweet to some extent. The second one is likes. If somebody really likes the message and it really resonates with them, they tend to like it. It's a very simple interaction, which we've seen. Minimum amount of reposts. Now, repost is a higher level of engagement where people are impressed by the message itself that they want to share it with their networks also. So they've seen somebody else share it, they really like it, they share it with their own networks. So that's how you measure reposts. So we have all of this, and the other great function that you can use here is date ranges. So if you know when your Congress has happened, you can select particular date ranges, so particular day, week, and year, and it will pull in that content. Now, when Scott earlier mentioned that it's just as important to monitor the days before the Congress and after the Congress, the reason for that is a lot of companies tend to release data in the run up to the Congress. So there may be discussions around that before that. Or post Congress, you have a lot of discussions where people like to kind of sit down and relax after the Congress and kind of compare notes. So you see a lot of important activity coming in post Congress as well, where people want to recap whatever they saw at the Congress. So a lot of accounts tend to do that. So they give like a recap of all of the key events that they attended at the Congress with highlights and probably images. So a lot of people like doing that to engage with their audience. So that's a very useful function to use here. So now just to show you how the search function works, I do an Indo 2024 search, and here are all of the posts. So here it is, you have Indo 2024, but since I didn't put in a date filter, it's giving me the most latest posts. So what I would do is I would scroll down where I can find a lot of the relevant posts. So since the event happened in Boston, we know that this is a relevant post. And basically, this is how you monitor a post. So you have the name of the person who shared the post, also information on the account itself. You have the actual content of the post, which mentions keywords. So anything specific to your topic of interest would be mentioned within this. You also have type of engagement here. So is it an image? Is it a video? Is it a GIF? Is it just text? All of this is very important data to monitor. And here at the bottom, you have all of the engagement functions here. So you have, this is the number of replies, this is the number of reposts, this is the number of likes. So all of this is important information to note when you do your analysis. Now for Twitter particularly, there are tools that provide you with hashtag analysis. So there are free tools that are available online that you're able to, once you sign up, they will provide you with hashtag information. They also do a daily monitoring for you. And also they provide you with a lot of information that is related to the top accounts that are sharing the data. So when I show you the report that I have created, I have used some of those free tools to generate that information. And of course, if you have access to a tool like Quello, you have a lot more detailed analysis and it's not bound by time. So once you have access to that, you get a lot more information there.
Shruthi, what's your favorite tool for doing the hashtag analysis?
I have a couple that I look at. So there is something called Simpler, which gives me a lot of the daily information that I require in terms of hashtags. And also, it gives a good view of what are the top people who are talking about that particular hashtag as well as the timeline. And if you sign up, you get something of a 7-day report. And you can go back up to 30 days to generate this. So I like that tool. So this was Twitter.
And
And
then one more question on that one.
uh,
So, can you maybe just speak to what thresholds do you like to use for replies, likes, reposts? So, how do you know whether to put in 10 or 100 or 1,000 in that part of the search?
That's a really good question. So I'm just going to actually show you how to do that here. So if I look at into 2024, I'm just going to type in a number here. So I want at least 50 replies. Or rather, I'll go with a better post, which is 50 likes, right? And if I search for that, oh, see, no posts. But sometimes what happens is if you just switch tabs, you tend to find data. It won't show it in the top section, but if you switch to latest, it shows you stuff. So here, this particular post has 778 likes. So it meets my threshold. So I know I didn't directly answer your question, but the best way to do it is by doing a trial and error. So before I set a threshold, I would do a scan of the data to see what kind of engagement I see around posts and then use that as my threshold. So this, I have a list of at least 50 likes. So these are all of the posts that I have, which are not too many. So I can actually increase the threshold here. So the first post that we saw had 770 likes. This one has 123 likes. So I think even if I push the threshold to 100, I will be able to find fewer posts, at least to identify which are the top ones that are coming up. And that's how I would do it.
Yeah, so I know in our previous conversations, one of the things that's maybe just to add to that is one, it's an experiment. You start, you make adjustments, but also as you add more restriction to the main search, right? So if you say, show me everything from Endo 2024, your threshold might be higher than if you then say, show me anything that mentions this disease from Endo 2024. You might have a smaller volume. And then if you say, oh, well, only show me mentions of this disease and these 5 treatments, you might need a lower threshold. So it is a bit of an experiment unless you have kind of the AI based tools that our team uses, but that's how you do it. You're going to use the tools that are available to you.
Yep. In the interest of time, I'll just quickly switch to LinkedIn. Unfortunately, LinkedIn doesn't have a very deep search function. There isn't a lot you can play around, at least in terms of advanced searches. A lot of it is manual because of the nature of the platform itself. But what we can observe in LinkedIn is the fact that a lot of the posts shared on LinkedIn are not just posts that are related to networking. We have a lot of articles, and we also have a lot of official posts that are shared by company accounts or representatives of companies that are talking about their presence at the event and how the event went. So again, you have a lot of the recap posts on LinkedIn as well. How you would use the LinkedIn search function right here is you would type it into the search box right here. And once the search results load, you would look at the posts to see what is being discussed here. Now, the thing about LinkedIn is it's a little bit finicky in terms of a platform. Sometimes when you scroll to the bottom of the page, you find all of the results listed in the same page. Sometimes it just shows you 10 posts in a single page. So it depends on your luck on that day, unfortunately, with LinkedIn. But there is also another drawback here. So I'll just scroll through a little bit more slowly if it can grab your attention just to show. I won't make you guess for too long. But there was another Congress also titled Endo 2024, which was the Endoscopy Societies Congress, which happened in Seoul, South Korea. Now, because both of the congresses are named exactly, you will find posts for both Endo 2024s right here. And there is no way to differentiate between that with just the search function on LinkedIn. You would have to manually validate that yourself. It's unfortunately one of the drawbacks of the platform. It's a great platform to gain insights, but there is a lot of combing through that you need to do in order to get relevant information here. So that's main thing about LinkedIn search functions. But when you look at the individual posts, the setup is quite similar. So you have the account from which it is being shared, the actual text of the posts, the media associated with the post, which usually consist of one or multiple images. And this is where you look for engagement. So you have comments, you have the number of reactions. So any reactions can be calculated right here. So these are the number of likes. Then you have comments, reposts, and all of these add to the engagement of the post. So if I look at one of the posts which have some sort of engagement, just to quickly show you what it looks like. Yep, this post has 31 likes, 2 reposts. Yep, quite an engaging post. And unlike Twitter, there is unfortunately no way for you to filter using specific subtypes of engagement or other keywords. If you use a keyword string instead of an individual keyword, it doesn't work as well with the simple LinkedIn search function. If I can quickly show you YouTube also, which was the third platform that was highlighted, YouTube works a little better with more detailed strings compared to either Twitter or LinkedIn. So here, if I were to search for Indo 2024, I'm going to get a lot of irrelevant results. Here I have the endoscopy results. I have things about the cardiac. I have things about cinema, football. There is a lot of information that is not really relevant to me. But if I type in Indo 2024 Boston, I have a lot of stuff that is specific and relevant to my particular topic of interest. And now, the best way to search YouTube is if you know the title of the video, and if you type the title in, that's when you get the best kind of results. But nobody knows that beforehand unless you actually search on the platform, which is a little bit of a cyclic situation. So that's the disadvantage here. But it helps that if you know more qualifying information. So I know that the conference happened in Boston. So if I use Boston as a qualifier, it will give me better results. And I know that for a fact. Now, if I were to open up one of these links, I can check out all of the detailed information related to its engagement, which right here includes the so you would have the number of views, you would have the date when it was posted, as well as a description of the video itself. Now, the key insight that you gain from YouTube is the fact that YouTube is mainly meant for long form content. Although now there is a lot of shorts and shorts are taking over YouTube. Conferences still tend to have more of the long form content that usually covers the daily webinar sessions or whatever happened during the event of the day, shared at the end of the day or post conference, because YouTube videos tend to take more effort to generate and to create the final product for, which is why it takes a little longer for YouTube videos to come up within the data. So that's the one thing. Of course, you would have shorts, but usually the shorts are the same shorts that you see shared on either Instagram or Facebook. So it's the same content that is being reused on YouTube, or vice versa. You create one on YouTube and you share it to the other platforms. Nobody really creates individual content for all three platforms. So that's an important thing to do. But shorts are usually not as insightful. YouTube is great for insights because you have these detailed videos. So this video, as you can see, these videos are as long as half an hour to a whole hour. And they have a lot of insight on all of the detailed topics that were covered during the conference. So YouTube is great for insights. And there are a lot of other ways you can filter the videos. So you can use the shorts or the videos filters. You can see watched or unwatched, recently uploaded. And there are a lot of other functions that you can use for YouTube.
Thank you
Yeah.
so much for sharing that. Those were just three of the platforms. As you can see, right, this the search strategy for each one is very unique and different. Uh, while we transition to this last step around creating a report, and again, everybody who asked for it will send out the step-by-step instructions for all the platforms we had listed, not just the ones we covered. I got a text in the background from Shruthi saying she would do that for us. So thank you. While we're getting the report and how we suggest to do a report pulled up, I'd love just to hear from you. What are some of the upcoming congresses that you think would be the most impactful for you? Like what congress would you like to do this type of social listening and analysis on? Just type that in the chat for me. And that way maybe Shruti can comment on a couple. All right, so we have AHA, AAO, okay, ophthalmology, ACC, Anybody else have any coming up that are particularly of particular interest? I know you've worked across so many of these therapeutic areas. Any comments based on some of these specific conferences, ACR?
Yep. Usually congresses, I mean, I don't want to pick out any one in general. I have worked on an ACR report in the past though for a Crohn's disease condition, but yep, rheumatology is a big space and there was a product that was used for Crohn's which was being discussed at the ACR event, and we covered the Congress. And the main challenge that we see when we cover bigger conferences is that identifying data that is specific or relevant to your therapy area is usually the challenge. So that's the thing. That's the point when you go to something like an ASCO or an EHA. It's so vast. There's just so much happening at the Congress, and when you have to narrow down to your specific therapy area, that's where it becomes a little bit difficult. Because, of course, if you want to know about cardiology, it's a great space, but you don't want to look through 30,000 posts because
Yeah.
that's what the usual volume looks like for most of these congresses. So it's great to be able to have support in terms of looking at individual platforms. People who know the strategy, people who know look at platforms, and I guess we are those people to be able to help you guys create those reports. There is a strategy that you would use differently for larger versus smaller congresses, and that would totally depend on the volume of the specific therapy area that you are interested in.
I think some of that can be in instructions, so it's really adding that disease state and even potentially treatment searches into each one of those searches that you showed us earlier. Wonderful. One of the questions that had come up earlier is really, now that you've done these searches and you've prioritized a couple of those platforms, now what? If anybody hasn't downloaded it yet, the handout for this session is actually a template created by Shruti that you can use to organize and share your findings. So, Shruti, you want to walk us through maybe an example of how that's used?
Absolutely. So the report is divided into very simple sections. So we have an overview, we have the top platforms, the top topics, top authors, and the topics of interest. So you always need to start off with giving an overview of the Congress itself. What are the dates that you've covered, an official website, official hashtags, and a description of the event itself. That's where I like to kind of introduce the report. And then moving on to the next part, which is volume, which is the first aspect of the report I mentioned earlier, which is how much of this data is being discussed. The platform overview really gives you a breakup of where the conversation is happening and how much of it is actually relevant. So this is a great insight to have at the very beginning of the report, setting the tone of the report as to where you've really seen people talk about a lot of the conversation that happens. And then you dive into each of the individual platforms the way I just showed you. So you would use the search strategies that I shared before to populate these slides. And once you have an idea of what the different posts are, you can read them and you can analyze them to get these insights right here, which are present on the slides. So I usually like to organize things based on likes, replies, and reposts because those are the three key features of engagement on X as a platform. And apart from that, I also like to give nuggets of information of what exactly is the overall data that I've seen on the platform. So was it about individual posters? I saw a lot of data that was related to individuals sharing their experience attending the Congress for the first time, sharing their poster presentations, and other people appreciating it. A lot of conversation also includes people who have won awards at the event. This, as an overview, is what I would provide as an insight for each of these platforms. And it follows a similar patterns for other platforms as well. On Facebook, we find that a lot of people share shorts. It's probably the same as on Instagram, but Facebook has a slightly better search function than Instagram. So you are able to identify what the overall posts are, what the conversation volume is, and a lot of the information that people share on the Congress on the ground is what you can see on Facebook. And as Scott mentioned earlier, a lot of it is networking related because of the nature of Facebook as a platform itself. LinkedIn would have information related to specific pharmaceutical companies sharing updates on what they have shared. So right here, you can see there are posts from different pharmaceutical companies. There are representatives of individual companies who are sharing updates. Also, people networking and sharing with their network about the various articles or poster presentations they have done at the session. So all of this is information that we usually see on LinkedIn. finally YouTube. YouTube has a lot of detailed data. So a lot of the topics or themes of conversation that come up in the final report would be from YouTube. The next section on the report would be the top topics. So here, these are the insights that I found from my analysis on various platforms. So I found obesity, pediatric health, diabetes, vitamin D, endocrine disrupting chemicals, and reproductive endocrinology as the top topics that were discussed during the session. And then the next section would be top authors. So this slide and the first slide have been done using the free tools that I mentioned online. So all of this information is received from there. So I like to represent it as organizations and individuals because usually they have different kinds of reach. Organizations being larger tend to have larger networks, while individuals not as much. So it's unfair to compare the both with the same threshold. It's not an apples to apples comparison. And that's it. You would end with an overview summary, and that's about it in terms of the report.
Wonderful. Thank you so much. And thank you for all the comments in the booth. Again, this is really if you are just getting started, right? And you are looking to do social listening, this is the basics, right? Now from here you can go much more sophisticated. You can do topic analysis, you can do insight sentiment analysis, you can do alignment to strategic imperatives and things like that, which is some of the things that Shruti and her team does when somebody hires us to do the social listening. I do want to just put it out there. If anybody would actually like help doing this, of course, you'll have the instructions. We showed you how to do it yourself. But if anybody would like help doing this, just put the word help in the webinar chat, and I'll make sure that we reach out, schedule some time to help do it for you, save you time, go a little bit deeper. But for everybody else, I hope that you took something out of this that you can use right away and increase the insights that you're getting. Thank you very much for taking the time to be with us. And for those of you who are interested, our next webinar is actually next week, really around optimizing the medical material review process. Again, we'll show you a case study specifically on how we helped organization with 4 coordinators manage over 4,000 materials a year while maintaining a 95% customer satisfaction score across their stakeholder groups. Thank you again for joining. Again, if you would like help doing social listening, please put the word help in the text and we'll reach out about it. Otherwise, we will send you all the handouts and we will go there. I'll stay on if you have questions. Do we have an AI platform to generate slides on the Congress analysis? Well, we can talk AI. So we have our own AI platform that we built specifically for medical affairs. So that's our favorite one. But as far as actually building slides, if I was going to build slides right now, I would probably start with Microsoft Copilot. If you have all of your insights and you've got content, you can use Copilot to help put that into slide mode if that's the part of the process you're having the most trouble with. Otherwise, if the AI is really around identifying and summarizing the insight itself, again, you can use the chat GPTs, the co-pilots of the world, get good at and practice your prompt engineering, or you can use a platform like Quello. There's a couple of others out there that are built specifically for medical affairs, where a lot of that context and the prompt engineering is done for you in the background. So all you have to do is ask the question that you have or say, please summarize the most recent insights, and it'll do it for you. Colleen, happy to show you some examples of that offline if you would like. Good. Well, I hope everybody has a wonderful end to your week, and we'll see you next time. Shruti, thank you so much. It was so much fun being here with you.